Are you having cough, running nose, fever? Are you being infected by coronavirus? Or are you more likely to be infected by influenza virus? Hello, I'm Dr. Lim. I'm the founder and medical director of Jasper Lodge Nursing Homes. Today I'm going to share something about influenza. Before all the recent novel coronavirus outbreak, influenza has been among us for a very long time. Influenza, or the more common way to put it, flu, is a virus infection caused by the influenza virus. How sure are you that you have coronavirus? If you are not exposed to anyone that has coronavirus, or has recently traveled to an area with coronavirus, or has recently came from Wuhan, China, it's very unlikely that your cough and cold is coronavirus. You should be worried about influenza instead. Based on signs and symptoms, we are not able to 100% differentiate between influenza and common cold. But based on my experience, influenza symptoms are usually heavier. It comes with high spiking fever, headaches, very bad running nose, very bad cough, and also an increased heart rate. Now here's a pro tip. How do you calculate your heart rate? This is your wrist. You can put your fingers on this part of the wrist, look at the clock, and feel your heart rate, your pulse, and calculate what is your heart rate in 1 minute. Normal heart rate is usually between 60 beats per minute to 90 beats per minute. Even if you get a common cold or low-grade fever, it is unlikely that your heart rate will go up. Now the good news is, influenza is easily diagnosed and easily treated by most general practitioner clinics. How to diagnose influenza virus? Very simple. There's a rapid test kit, and the doctor will take a small brush, put it up your nose, put it into the sample, and in 15 to 20 minutes you will be able to get the results, whether you have influenza A, influenza B, or H1N1. Influenza can be especially serious in people with low immunity, such as those with diabetes, those with kidney problems, those that are older, children under 12 years old, in the high-risk category. Influenza is very treatable. There's this medication called Tamiflu or oseltamivir. A 5 days course will almost guarantee to get rid of the virus from your system. Sometimes after starting on the antivirus, the symptoms may slightly worsen before it gets better. So don't be overly worried if the symptoms slightly worsen during the first or second day on the antivirus. Sometimes when you are attacked by influenza virus, your immune system may be lowered and some naughty bacteria will take the opportunity to infect you. So in this case, your symptoms will actually worsen and you may need antibiotics. But in most cases of viral infection, antibiotics are not necessary. So influenza vaccine has become extremely popular. Everybody is looking for influenza vaccine now. But some people ask me, why after getting the influenza vaccine, I still fall sick, I still get running nose, coughing, or fever? That's because not all cough and cold is caused by influenza. It could be caused by other viruses as well. And at this point, there are no vaccines for those type of viruses because they are usually mild and self-limiting. That means after a few days, whether you do anything or not, the virus will go away. Therefore, you do not need specific treatment or vaccine. Some people ask me as well, why do I still get influenza after getting the vaccine? Now, we have to understand that there are many types and strains of influenza virus. The vaccine only covers the most popular 3 to 4 types of influenza. Therefore, if the virus does not fall into this category, you may still have the chance of being infected by influenza virus. Here's another pro tip. The common type of influenza changes every year. Therefore, the components of the vaccine changes every year as well. So record down when you last had your influenza vaccine and make sure that you get your vaccination on a yearly basis. Still worried about coronavirus versus influenza? Fear not. If you have not came into contact with anyone with a history of coronavirus or traveling to coronavirus outbreak areas, it's very unlikely that you may have coronavirus. However, do not take influenza lightly, as it may result into a more serious infection as well. So if you have severe symptoms of flu, coughing, headaches, increased pulse rate, fever, go see a doctor and make sure you get your vaccine every year. If you have any further questions about influenza, please ask in the comment below and I'll answer all your questions.